friends, ladies and gentlemen. It is a very testing time for the humanity. As you would know, that we are struggling with a pandemic which has engulfed the whole globe. Almost more than 200 countries have got affected by this coronavirus, or what is the disease status called COVID-19. Take precautions because it is a preventable disease. If we take adequate precautions, if we do social isolation, if we live in our room, if we live away from people who have been exposed, who are positive, and then people who have come from abroad suspected to have carrying the COVID-19 virus, then we can prevent the spread. So basically we need to break the cycle of this spread. We need to see that who are the people who are at a high risk. So anyone who has a history of travel history, those who have had contact with a patient suspected to have flu, anyone who has been nursing these patients, and anyone who has tested positive. So this is the high risk group, and we need to know that it has got a mortality rate of 1 to 2%. However, people who are diabetic, people who have established heart disease, people who are otherwise low immunity, that is people more than 65 years or 70 years of age, they are more affected. Those who are on immunosuppressant drug, renal or kidney disease patients, patients on dialysis, all these patients have to be more careful because the immunity will not, spare them. And ultimately, this virus leads to end organ damage. Unfortunately, we do not have any foolproof treatment for this, and that is why prevention is the best mode of attacking this disease. If we break the cycle of spread, we will be spared. If you see that people who have had exposure to this virus, like healthcare professionals and all, there is ICMR guideline and internationally also, because we don't have any drug which really works. It has been shown that hydroxychloroquine dose can do some kind of preventive job. The other thing is that mask has been, of great help. If you see the wearing mask, if the in public places, whenever one goes out, one should wear the mask, and then hand washing and not touching, because this virus is stuck on the surfaces, and also touching any surface should be avoided. We should try to wash hands hourly or 2 hourly, or whenever we touch something which has come from outside, like somebody has delivered at home some groceries or even some other material, we should try to wash hands. The trick is that washing with alcohol is not enough. Even the soap wash is very good, provided we give a 20 seconds of rub on our hands and then let it get washed in a flowing water. What it does is that it removes the virus, it kills them. So that is why there is so much of importance of hand sanitizer with alcohol based product, because if the alcohol is more than 65%, they can also kill this germ and prevent the spread. One should avoid touching the nose and mouth frequently. One of the reasons why it gets through the nose and mouth is because these the two places whereby we inhale the air. So the chances of sucking the droplet into our system is very high. Once the virus goes within, 80% of them would be more or less mildly symptomatic or asymptomatic, meaning thereby that they'll feel as if it is a common flu. But it is different from common flu in the sense that it is very, very contagious. It can spread like a fire. It can, spread very fast. So you should avoid contact with anyone for more than 10-15 minutes, because the data have suggested that if we spend time 15 to 20 minutes with somebody, then the chances of transmission either way is very high. The cardiac patients is a big dilemma, because initially the cardiologist did not feel that the heart attack patients and the cardiac arrest patients could be one of the presentation of COVID-19. We learned a lot of things about the cardiac presentation from Italy data, and also from United States of America, and in China also, to begin with, that almost 20% of the COVID-19 patients may have heart disease, but they have mortality much higher. So if somebody has got a cardiac involvement, the mortality could be almost 37 to 50% compared to 1 to 3% in patients who did not have cardiac presentation. We see that these the patients where the troponins are high, they may have cardiac arrhythmias, and it could be a simple myocarditis also. However, some of the patients may have occluded arteries also, but majority of them would not have ST elevation MI. They would have some vague breathlessness, chest pain, and rise in troponin level. So these patients should not be rushed in to cath lab. So, as you would know, that the golden treatment, or what we call the best possible treatment for ST elevation MI, that is the acute heart attack, is by doing a primary angioplasty. But a lot of senior cardiologists burned their fingers, they became positive, and even, unfortunately lost their lives also. So therefore, the Indian body, that is Cardiology Society of India, the European Society of Cardiology, and even the American College of Cardiology has framed a guideline that if in the COVID era, patients who come with heart attack, we should try to do thrombolysis, that is clot busting therapy should be given, and then the regular maintenance and supportive treatment should be given. There was a lot of discussion about whether these patients should be given ACE inhibitor or ARBs for hypertension. But now the jury is out. There is clear guidelines that the patients who are on ACE inhibitors and ARB, they are more protected from the adverse events of COVID than the patients who are not on them. So one of the confusion initially was that it apparently works through ACE inhibitors and ARB receptors, but now it's clear that it is always better to give these molecules for antihypertensive. And even in patients who have got left ventricular dysfunction, these patients would be benefited by these molecules. The other thing is that paradoxically, a lot of patients who become severely affected, they have multi-organ thrombotic event. A lot of them would have features suggestive of pulmonary thrombolism. A lot of patients would have renal dysfunction. So of late, we have been seeing that around 25% of patients will have GI involvement, 20% of the patients would have renal involvement. A lot of patients would need renal replacement therapy, and then the cardiac involvement is the maximum because these are the patients who suddenly deteriorate and can lose their lives. And the patients go into multi-organ failure. Other paradoxical thing of this infection is that these patients would be better off with oxygen than on ventilator, because the patients who go on ventilator, their chances of survival is lesser. Patients do better with oxygen therapy than on invasive intubation. So again, that's a new thing which we have learned. As far as protection of the humanity from this virus at this moment is concerned, only solution would be vaccine, which is still quite far away. We have this morning got the information that the three companies, one in UK, that is ChAdX1 vaccine human trial has started, one in Germany has started in collaboration with one of the Indian companies also. So probably by September, we will have some of the other form of vaccine, and also we would have some amount of immunity in the community by the end of May, probably. But still, we are in the middle of this epidemic in our country. I would say that we should do as much as preventive steps, like the government has given us what we call Arogya Setu app. We can download that app, and that really gives a very, very good information about the presence of infected persons in the community around us, and that alerts us that whether the social distancing has to be done, whether we need to do isolation, and so on and so forth. I must compliment the government of India, which have taken a very, very early step of, lockdown. And you can see any country where the spread has been minimized has been done only by two mechanisms. One is the lockdown, which has got forced isolation of the people, preventing them intermingling with each other so that prevent the cycle of spread. And the second thing is identifying many people with the virus load, and that is meaning thereby that testing and finding how many people are harboring or infesting this virus who can possibly spread this to the community. So more and more tests it should be done. It should be, in a scarce healthcare and financial resource company like India, country like India, we should be focusing it on high risk people, those who are healthcare workers, those who are in the exposed group, those who are in the airline group. So anyone who is at the high risk and the contacts, everyone should have, test of this coronavirus. Even the patients who are going for any procedure, ideally the patients should be tested, and if they are positive, their family should must be screened for this, and only by that we can identify this virus and then do isolation so that it does not spread. So to conclude, friends, ladies and gentlemen, I would say that in this testing time of corona epidemic, stay home, stay safe, keep social distancing, keep on washing your hands, keep alcohol sanitizer, and simplest of the lot is use the mask all the time whenever you go out into the community so that the spread of this virus can be contained. Thank you very much for your kind attention.